Hey guys, it's Brandon Green here. We've got another episode of the podcast I haven't done for a little bit now, but we're back on it, and we've got Tim Flatt. I told you season 3 was coming. We kicked it off last week with the lady who had Lyme disease, and now we've got Tim Flatt, who's the CEO of Real Time Voice Analyzer. Tim, how are you? And you've got quite a interesting and intriguing app to tell us all about.
Well, thanks. I'm doing very well. I'm really glad to join you and be part of this podcast ever in Australia. So I'm excited about doing it.
Yeah, man, no worries. Well, it's good to have you. So tell us about this app that you've got, Real Time Voice Analyzer. You're saying that an app can detect if you've got a viral infection going on?
Of respiratory viruses attached to your vocal folds. And so, just like a doctor for a couple hundred years now, they've used a stethoscope to try to hear the inside of your body, to hear your heart or your lungs or your bowels, as a screening tool that says, okay, now that we know, and where do we go from here? And that's exactly what our test is. Our test is just, wouldn't be able to detect the virus on a vocal fold with a human ear, but because of technology now, they can do it. They can establish algorithms so you can listen for that vocal fold, and then through AI they can apply it. So basically, it's exactly right. Anytime you have a respiratory virus, it's detectable from the sound of your vocal folds.
Yeah, right. Well, there is the smartphone that came along, and they've only been out for the last 10 years, and they're being used for many different types of things, detecting people's sleep apnea. You've got the camera on there that obviously detects the heart rate, which is all very,
right.
How do I say, accurate. How do we go about the scientific research or any accuracy into this product?
Well, so I mean, we establish on our website all the scientific data, and that's been done at Carnegie Mellon University with Dr. Singh, who is the inventor of the technology, and she's a world-renowned voice analyst. Also, there's been studies at Cambridge and Yale and MIT and a university in Netherlands. They've all established the same thing. There's not really any question of the science that's what happens, and that's where the virus sits. It really comes down to how do you detect it, and that's we're the first ones to be out in the marketplace with a patent pending product that actually detects it. Now, the one thing I want to say right from the very beginning, this is a lot like, like I said, a blood pressure medicine. Blood pressure cup that you'd use at home to take your blood pressure. We're not designing this to diagnose or treat or cure or prevent COVID from you. We're just it's a screening tool that lets you know, hey, there's something that's not right, and now I need to take the next step. And that's really how it's designed, because we don't want to act like we're somehow going to replace doctors with this, because that's not the intention. The intention is to give you control of your health. So if you get something as, like, say, allergies, you don't need to run to the doctor thinking you've got COVID, because you can use this device, real-time voice analyzer, to determine that there's no you don't have a viral infection.
Right. So it's more of just something that you're saying it's a tool to use that you can use, that's on your phone, so you can use it. And if you've got a viral infection or you think you may do, then you can whip it out. You're not saying that it's going to cure you and all this.
Yeah, let me kind of position it. Let me kind of position it for you. Think about the rapid tests. That's what we call them in the States, right? The COVID rapid test. That wasn't a final diagnosis, but that was kind of the diagnosis that told you if you needed to take another step. In the case of during when COVID,
that was
really
definitely a final
strong
diagnosis where I come from in Australia, man.
Well, I mean, but I'm saying the doctor didn't take action off of that, right? I mean,
in
you still
Australia,
had, when
man,
you went to the doctor,
yeah.
Okay. When
Yeah,
you went,
yeah, yeah.
okay.
Correct. It didn't mean to people like me and you. Yes, it obviously meant it was just a rapid test. Yes, but to the world that went lockdown crazy in Australia, that meant stay inside or you'll go to jail, kind of thing. Yeah, you know what I
Okay.
mean. Yeah,
Right. Well, I understand it was a little bit unique in the way different countries handled the COVID pandemic, but certainly the idea is that they would still get the doctor would still do a PCR test. The doctor would still do and make sure they would do additional screening. Just like a doctor wouldn't listen to your lungs and say, "Oh, lung cancer."
yeah.
Through a stethoscope, he'd say, "Okay, we need to do an X-ray." It's a screening device. So here's how we position it. It's a situation where this is scientific research has proven that this test, the real-time voice analyzer screening test, is more, at least as accurate, if not more accurate than a rapid test. All right.
Yeah, wow.
That's scientifically proven on our website. So start with it there. It's at least as accurate as a rapid test. Now,
Well, that's incredible, man.
with that,
Come from Australia, we were
with
massive and still are big on the rat test.
okay, okay. Well, so now you don't have to put anything up your nose. It's non-invasive. All right.
Yeah.
So no nasal swab. First of all. Second of all, in the US, our COVID test costs about anywhere from $10 to $12.50 per test.
Wow.
Our tests at the maximum price are $1 per screening test. So you're at 1/10 of the price. So nothing, no, it's faster. You're going to get results in 5 to 10 minutes versus, on a rapid test, 15 to 30 minutes. And then you're always
After
wondering
you've done it,
with a
yeah.
rapid test,
Hmm.
did I do it right? Did I stick it far
Yeah.
enough up there? Was there something on the nasal swab that shouldn't be on the nasal swab, right? All those kinds of things happen. And that's what makes a non-invasive test superior.
Yeah, man, I 100% agree. It sounds more convenient as well. There's convenience and time. There's a few things going for you, but has there been any clinical studies or anything with this?
Yeah, I mean, their clinical studies were done in the Philippines, India, and the U.S. Okay, and they went through and they did them in health clinics, and they had people come in, they tested them, and then they gave them a rapid test or a PCR test right after that, and then they evaluated it all. And we did that. That was done for like a year before we began putting the app together to verify everything was right. So I think our testing is strong. Our science is very, very strong. And now we're just putting it out there. And what we're doing is that we're just giving everybody who wants to try it just 10 free tests. We don't take your credit card. We don't take any financial information. So we're not going to say free trial, but charge you 3 days later. Okay.
Yeah,
Right now in today's
does.
day and age, free means they say, we'll give it to you for free. Oh, by the way, we need your credit card just in case.
Yeah.
And what the just
forget.
in case is just in case you forget to cancel. Right. Exactly. So it's truly free. You get on, you get 10 free tests, and then you get one test a month. Yeah. One test a month for the next 11 months for free. So you get 21 free tests when you sign up during our introductory time here. And we'd love to have as many people try it out. And one of the great things about this test is this: a portion of every actual test in terms of the paid test that we do goes back to funding. And this particular product has the ability, with more scientific research and more clinical studies, that eventually it could become one of the most significant screening tools in the world, used in doctors' offices as well as on people's individual phones, actually determining what kind of respiratory virus you have long term. Not now, 5 years from now, 10 years from now, but it's amazing what they've done so far, and it's going to only continue to get better and better as a screening device as we continue to feed the funding meter.
Yeah, well, if you're definitely putting money back into the funding, and then you've obviously got this stuff set out. So you sent the app around to these different countries, and they tested it, and it came back that it actually is quite consistent with the other testing that we do.
Oh, absolutely. Yeah, that's exactly. We didn't set it around. We actually had our technology partners, a company by the name of Hematico, and they actually had people on the ground as part of the clinical studies at the health clinics for weeks at a time, making sure that everything was done right, data was recorded properly, and so that's how it was done.
And can it detect other different between different variants of COVID? Because we always hear that every few months there's a new variant of COVID spreading around, or people think that they've got COVID, but they've actually got the flu. Like, how does that all
Right.
work? Or it just tells you got a viral infection?
Yeah, I mean, so it's mainly designed for COVID. It will pick up new variants. It will also pick up strains of the flu or even the common cold that if they are kind of close to COVID. So that's why we really caution people, say a positive test does not mean you definitely have COVID, but it means you have some sort of viral infection that's been detected. Something's been detected. Now you need to take the next steps. And what our device is most effective for, our screen tool is most effective for, is, let's just say, for example, I live in Puerto Rico, and I just came back to the island a week and a half ago. And so when I came back, I got a lot of congestion. That's you go from being in London, and you end up in Puerto Rico, pretty big climate difference. I got a lot of congestion. Well, a couple of friends of mine had COVID. So I thought, well, I had a breakfast meeting one morning, 8:30. And about 7 o'clock, I was thinking I probably should cancel it because I'm all congested. And I realized, wait a second, why don't I just take a test on my phone, do a screening? So I did a screening. It came back negative. So I felt very comfortable continuing on with my meeting that morning, and knowing that I just had a sinus, some congestion from coming down here. It wasn't a virus. It's that peace of mind that gives you that's where the strength is. And as far as the detection,
it would be nice knowing that you would have been done with it all within 24 hours and then not having a virus for the next week or something to contend with you.
Absolutely. It's just, so that's where it comes in. It's all about peace of mind, knowing that you can go out and
well, that you won't infect other people that you come around. Yeah.
Right. It's really about stopping the spread, and a peace of mind. And once you get that in mind, then, when you get a positive, well, then you got some work, a little few things you want to check out, but that's okay. You still got a lot. The negatives are what you're looking for, obviously.
Yeah. So you want a negative result. And who is the target audience, would you say, for this product? Like, are you pushing it towards a certain demographic, or like we're get
not
viruses?
Yet, people, if every person in the world, and so you don't really know which markets can respond the best to it. I mean, example, do the people that are wearing masks around still, are they the best opportunity for this here because they are most concerned, or are they the worst because they might be like, no, I got to have a PCR once a week. I'll pay the $100, $150 to get a PCR.
Really?
You just don't know who the best market is until you get out there. So that's why I'm doing a little bit of a podcast tour. I'm getting out there and doing podcasts around the world, and we'll evaluate in about 3 to 6 weeks. We'll look at it and say, where do we go now? Where's the strongest places in the world to promote this? And then we'll start to develop demographics from that and begin our marketing campaigns.
Yeah, right. And so where is it based out of, like your headquarters? And do you have how long has it been in development for?
Okay, so real-time voice analyzer has been in development for about 3 years now. All right. Our main company, I have a business partner, Ron Snodgrass, and myself. We started a company called Real-Time Pain Relief. And it's a topical pain relief, but it was really the beginning of our brand. And so Real-Time is our brand. And we have 5 or 6 companies now. We're based out of Cabot, Arkansas, and they all run on the Real-Time brand. So Real-Time Health Pass, Real-Time PPE, Real-Time Products, Real-Time Pain Relief, Real-Time Voice Analyzer. And so the company's been around for 25 years. The parent company's been around for 25 years.
Oh
We
wow!
have
So you've already got a
offices that
bit
we've
of
had
skin in the game, yeah,
good.
in the whole health industry,
Oh
and
yeah. We've been at this for a long time. Yeah, exactly
yeah.
right.
So
And
that's
this
how
is
you
the
knew.
next move for us. We have a large customer base. And that's one of the ways we'll determine our market is through our customer base, because we'll be able to tell which customers are responding to it and stuff like that. So it's different. It's a free offer. So it's really hard to know. And we, like I said, we're not doing any external advertising. We're getting out there to the grassroots, and we're going to let customers decide.
And it was so simple. I just clicked the link, downloaded it myself a week ago, and gave it a test. And yeah, from very simple to set up, anyone can use it. You just go through the prompts. Next minute, you're doing the test with the. You got to make the vowel sounds like E, O, I believe, and that then your software in that app then must detect those vowels not being pronounced properly or something. How does that work?
Well, yeah, what it does is it records those sounds, and then it sends it off to our algorithm cloud, basically. And
Mm-hmm.
then there the AI applies that, and it picks it up in the voice, and then what it does, it will give you a result. And that's what takes about 3 to 5. Well, we say 5 to 10 minutes, but typically it's a little bit faster in 5 minutes that you get
It's probably a
results.
few minutes, yeah. And so how
Yeah,
did
and
this
so
come about? When you said you followed a doctor's work on the study on this for they've been studying decades or something, that the voices,
yeah.
that's where the virus sits now. How did it come
So
about
Dr.
where you
Singh, okay, Dr. Singh, she's the star. Okay, so I don't want to ever get away from the fact we're not technical, we're not scientists. Ron, Snodgrass, and myself, we're not scientists. So what she was doing, she was working in the U.S. with government agencies like the FBI, CIA, and she was using the vocal folds and the sound to determine whether people were telling the truth or they were lying. They could determine that from the sounds out of your voice, right? And so about 10 years ago, she had said, hey, I'd like to do something on a more positive note than just this. I want to create something that's positive, for humanity. And so she began looking at, they determined that in their research labs, with their PhD students, they determined that RSV could be determined from the vocal folds. And they began researching it. They didn't have a big funding budget. They never got the project done, but they knew the science exists, and they kept doing it little by little as they could. Fast forward, that was in 94, I think. Then fast forward, and COVID hits, and they're like, this will work for COVID too. So they switched their research and focused on COVID. Of course, it's easier to get funding for COVID than in the middle of a pandemic than it is for something like RSV. They were able then to expedite it and get it figured out, and to create the algorithms. And I'm going to tell you right now, I just example, a week ago, I was told that they are days away from creating a new algorithm, because when you work with AI, every time there's a test, you get smarter. And so they'll continue to increase the algorithms, and we'll be installing a new algorithm sometime during the month of November that's even superior to the one that you took. And we'll continue to do that. We hope that will happen every
I'd say the more people that
months.
use it and the more positives it sees, it just keeps learning and gets more accurate and better and grows as time goes on. That's what happens with this kind of stuff.
Exactly right. Exactly
Yeah.
right.
Yeah, right. And is it available in all countries so far? Do you know?
It's absolutely available in any place that you can download at the Apple Store or Android/Google Play Store. Those are the two stores we have it in. And as long as you can download and use in those countries, you can. I think there are a few banned countries, but I mean, we're not. I don't think we're. I think China, for example, I don't think we're in China. We chose
North
not
Korea.
to go there.
Maybe
North
there
Korea,
either.
right? Yeah. So if you're listening from North Korea, you get bigger problems than COVID. So
Yeah. What about so it's quite interesting. I'm fascinated by the whole it was primarily developed for COVID. How do you? So you're saying that COVID just can be distinguished clearly through this type of technology rather than just a cold or a flu.
Well, every virus has a footprint, right?
Right.
Just like when they take your blood, they can determine what virus you have from your blood or what you have because they can analyze the blood. It's similar with the voice and the vocal folds and the viruses that are connected there. Again, way over my pay grade.
Yeah.
And on our website, we actually have a 96-page paper that was written that explains everything in detail.
Oh wow.
Now, I get lost. We have two of them on there. We have a 6-pager, we have a 96-pager, and they're the scientific details. I'm good through about the second paragraph, and then after that, it's kind of over my head.
Yeah.
I've been doing this for a long time, so I've read a lot of studies before. But what these guys are doing scientifically, what they've been able to determine, get into a patent pending stage, it's incredible what they've
Well,
done.
the proof's in the pudding by what you said, where the actual medical centers used it against people that had verified COVID, and it came back. You said just as
Yeah, and they got
at least as
smarter.
accurate. Yeah.
I'm sorry. When they first started, their results were in the 60%. By the time they were done, they were getting results in the 90% accurate.
Yeah. Wow.
Because over time and months and like we've been talking about,
learns.
the knowledge is what happens. You get knowledge and it gets better. Yep.
Yeah. So with the is it more to do with like older people or senior? I'd say that would be a good target market as they were.
Okay, so here's the deal. As you look at that as a target market, so my mom is 82 years old, and I helped her download the app.
Yeah.
The older people get, the less technology they have, the less likely they are to use an app. Mm-hmm. So I helped her download the app. It was not an easy process. Okay, so you wonder, is it more college age students, and then they show their, like, because they use apps all the time. They click, boom, they're on. Yeah. Or is it the people who, like with real-time pain relief, our main customer is the caregiver, so that's going to be a woman in her between 35 and 55, because they're helping their aged parents. Honestly, have no idea. Female than male in the end, because males tend to be a little bit less as a group, not everyone. So we just don't know. We're going to find out, and once we do, we'll market. We'll market to all groups, but we'll have some specific marketing. To our target group
in those specific things. And how long has it been out so far? Yeah.
It came out in October. We had it on an app, and we started testing it back in April. And out of the abundance of caution, we tested it. They thought we would test it for 30 to 60 days max, and we tested it for 5. We tested it for 5 months.
Oh,
we were in no hurry to get it out. We wanted it to be right, and so we did about 5 months of testing, and then we came out with it. And now we're doing about 60 days of Grassroots, where we're just adding, a couple dozen people a day using the app. And then once we are completely happy with everything and we turn on the advertising, we expect to be adding thousands of people a day to use the app.
Yeah, well, it sounds a no-brainer, especially for the promotion you got with the first year, that you get free tests for all year, pretty much.
And we're going to have ways you can earn free tests as well.
I like referrals and things
within the app. It's going to be exciting. Yeah. Kind of a gamified type deal we're going to have in there.
All right, cool, man. And if someone had the app, can they, and they were within an organization, can they use the same link kind of thing?
Oh, absolutely. Yeah. I mean, that's one of these where we've got a number of groups, larger groups, church groups, social groups that want to put it out to their members, and we're saying you can do it. Just give us. We're asking them to give us till November before they start promoting it to their groups, just because we want to make sure we've got a chance to do it. But that's going to happen. We're going to see a lot of mass adoption coming from those kinds of groups of people. A sports team where youth sports team where one mom gets it and she's using it, and then she's sitting in the stands, and the next thing you know, they're sending it out to links out to their entire 30 to 40 group parents, and they're all downloading it. So that that kind of stuff, we know it's going to spread that way. We're just kind of slowing that down right now.
Rat tests are hit pretty easy. We call them rat tests over here. I don't know if you've heard that name before.
I have not.
No, rapid antigen test, rat. So they're called rats in Australia.
Oh, rat test. Okay.
Yeah. And like we get them cheap as anything, but like anything healthcare related in the USA, it just gets ramped up. So this is very, very good app. If someone's just got it on their phone, hey, do you have real-time voice analyzer? Boom. And then they're it's a no-brainer.
Sure. Anytime, anywhere. That's the key, right? You could use it anytime, anywhere. And most importantly, and I can't emphasize this enough, but people hated, a lot of people who didn't get serious COVID hated about COVID was the nasal swabs.
Oh, yeah.
Nothing worse than the nasal swab.
Yeah, man. I had to get 10 PCR tests before they'd let me leave UAE, Dubai a year ago.
Yeah.
And it kept just going. And I said, man, this will go positive forever. Like, you got to let me out.
Yeah.
So I just paid some dude that did it to give me a negative. But yeah, well, thank God the world's moved on from that. But COVID's still such a problem, isn't it?
Well, here's the deal. Right now it's at a lull. But the way I always tell people when they say that, well, you're bringing out this product at the wrong time. And my answer is this: influenza since 1918. All right. It didn't go away, and respiratory viruses don't go away. They find a way to come back. This year may not be a year where it's terrible. There might be new variants that are bad, but we will have COVID outbreaks over the next few years, and we're going to be prepared with a real-time voice analyzer to be there for people to be able to screen and be comfortable with using it, our screening anywhere, anytime, and it's going to help slow the spread down when that happens.
Well, that's when you don't want to get, because I'm in a lot of long COVID groups on Facebook and things like that, because I've got long COVID, and I've got that from an infection in February 2020, right before it all locked down and everything. And I have seen there's still people getting COVID infections and getting long COVID in the last 6 months. So it's
there.
Not
it's just not
prevalent
as
it was very early on, but yeah, it's still there. And there's people that get better from their long COVID and then boom, knocked down again, which happened to me as well. Because I've had it like 4 times now. But yeah, it's not a good disease, and you want to keep away from it. And something like this can only be. Yeah, I'm excited for it, man, because I'm keen to see it grow, and it should grow like wildfire, because you've been very generous in what you're offering initially to people, so they don't have to pay anything. There's no scam tactics. You don't want their credit card and hoping that they forget, like every app and thing that you go to use on the computer these days. It drives you mad. You understand that, and you just genuinely want to help people with something that is scientifically backed.
Well, I appreciate that, and I really appreciate you having me on the podcast today. And I hope that this is a real valuable tool for yourself, with the fact that you're always going to be keeping an eye on COVID since you've had long COVID.
Yeah, man, I'll definitely be keeping an eye on it and letting everyone know myself, like, hey, guys, download this app. Oh, thanks for coming on, Tim. Was there anything else you wanted to add today?
I think you did a great interview, man, and you covered everything, so I really appreciate it.
All right, no worries. And Tim, thanks, Tim, coming on, and everyone check out the app, Real Time Voice Analyzer.